Hi guys, it's Dr. Adam here. If you have arthritis, what you eat really matters. In this video, I'll explain briefly the science behind this and then run through some of the best foods which have been shown to help reduce arthritis symptoms. I hope you find this video helpful, and if you do, please remember to like and hit subscribe. As always, this video is for information purposes only, and you should check with your doctor if a diet plan is safe for you, especially if you have any other medical conditions or take any medications. So number one is foods rich in omega-3 fatty acids, which have an important role in cell function and have anti-inflammatory effects. Oily fish such as mackerel, salmon or sardines, seeds such as flax seeds or chia seeds, and walnuts are all rich sources of omega-3. This meta-analysis of 9 randomized control trials containing over 2,000 people with osteoarthritis showed a significant reduction in arthritis pain associated with taking these omega-3 polyunsaturated fatty acids. Lots of different herbs and spices may be helpful for arthritis, but my favourite two are garlic and turmeric, which have both been shown to reduce joint pain and swelling. The results of this systematic review about the effects of turmeric really surprised me when I read it. The authors looked at 10 studies on the pain-relieving effects of turmeric in people with arthritis, and what they found was that it had a similar effect to non-steroidal anti-inflammatory drugs. Interestingly, black pepper contains a substance called piperine that enhances absorption. Now, for most people, turmeric is safe, especially in the kind of quantities we use in food, but you should be careful not to have too much, and the recommended limit is around 8 grams or 3 teaspoons per day. You can try mixing it in soups, spiced teas or coffee, or in rice dishes. Another way to get the dose is through tablets. While turmeric spice typically contains between 2% to 9% curcumin, which is the active ingredient, supplements may contain up to 95% curcumin, so maybe a more efficient way to get the dose that you need. Next is my personal favourite, broccoli. Research has shown that a compound called sulforaphane found in broccoli, as well as sprouts and cabbage, slows down the destruction of articular cartilage. A randomised control trial is currently being undertaken to investigate the effects of broccoli further, after initial results from a study in the UK showed that eating a concentrated broccoli soup 4 times per week for 3 months led to a significant reduction in pain in those with moderate to severe arthritis that wasn't bone on bone. The ends of your joints are covered by smooth articular cartilage, and there's emerging evidence that the cells that make up cartilage, or chondrocytes, can be affected by nutrients in our food, and in particular by free radicals that cause oxidative stress. Polyphenols. Now, these are compounds commonly found in plants and in particular berries, and they can have a powerful protective effect, with evidence they help pain from arthritis. They've also been shown to be protective against cardiovascular disease and a range of other conditions. They're found in spices such as cloves and turmeric, nuts and olive oil, one of the cornerstones of the Mediterranean diet. Fiber. There's growing evidence that increasing dietary fiber can reduce the risk of developing symptomatic arthritis and many other conditions. In this study that used data from thousands of people, higher dietary total and serial fiber intake were associated with significantly less worsening of knee pain in people with arthritis. Fiber seems to have a beneficial effect on the gut microbiome and promotes a systemic anti-inflammatory response. Whole grains, wholemeal bread and beans are great sources of fiber, and 3 of the best high-fiber fruits are passion fruit, avocado and prunes.